It's Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. This is where we discuss, we dissect important health issues that matters to everyone. And today we'll be talking about hematemesis. It's a very, look at the name now, hematemesis. It's a very serious condition, and it's something that we want to enlighten people about it. What's the cause? How it affects people? How you can manage or treat conditions like that? How you can help someone that is having hematemesis. I am here with Dr. Dimma Favor. Hi, Dr. Favor.
Hello.
Compliments of the season.
Oh my gosh, wishes.
Compliments of the season. We had a wonderful festive celebration. How was your Christmas?
It was awesome. We're still in the season, so
Yes, we're still in the season. Okay, so today we're talking about hematemesis.
Okay.
Hematemesis. Dr. Favor, what is hematemesis?
Hematemesis, just like the name, I'll break it down. Emesis is vomiting, is the medical word for vomiting.
Okay.
Then hem is always, when you hear him, it's referring to blood. So hematemesis is vomiting blood in simple terms.
So, Dr. Favor, what is the difference between vomiting blood? You just said hematemesis is vomiting blood,
Yeah.
and the blood coming out from the nose.
Alright, the differences, I think there are quite a number of differences.
Okay.
First of all, the route.
Yes.
Vomiting blood is from the mouth, while blood coming out from the nose is from the nose. Secondly, medically, we refer to vomiting blood as hematemesis, while nose bleeding as epistaxis.
Epistaxis.
Mhm.
Sounds like Nigerian tax.
Then another difference is this: the causes. The causes are different. For nose bleeding, different things could cause nose bleeding, like trauma. Someone could blow the nose and then the person is nose bleeding. High blood pressure could cause bleeding from the nose. But the causes of hematemesis are quite different from the causes of nose bleeding.
So, when it comes to vomiting of blood,
Okay.
hematemesis, does the color matter?
Yeah, the color matters. So you could see a patient now coming with vomiting bright red blood, and then another patient like vomiting dark tarry blood. When I mean dark tarry, is that the color of the blood is darker than normal. So someone vomiting bright red blood is telling you that this bleeding that is ongoing inside is an acute thing. Like it's just happening, something that's happening recently, like while dark tarry blood is something that has happened a while ago, and then that blood has been broken down.
Okay.
So just like when someone is passing out, like stooling bright red blood and dark colored blood. The difference is that the dark color, it has been broken down, it has been acted upon most likely by gut microbes to give that dark color. But the bright red blood is still like fresh blood. No organism has acted on it, and that's why it gives that bright red color. So
Okay.
this is just the difference. So most likely, the bright red vomiting is from somewhere closer. So that's why, because it's from somewhere closer, more proximal,
Okay.
the organisms are down there in the gut, so they can't act on it. But one coming from somewhere more distal will be acted upon by the organism before the person vomits it.
So, what could cause hematemesis in adults?
There are different things that could cause hematemesis in adults. For example, a patient who has had or who is having liver cirrhosis. Remember, we've had a discussion on liver cirrhosis. Yes, so various things can cause liver cirrhosis, whether viral infections, alcoholism, different things. So a patient who is having liver cirrhosis, most times patients with liver cirrhosis, they come down with portal hypertension. And then just like the normal term hypertension is when the pressure in the vessels are higher than normal. So in this portal hypertension is now the pressure in the portal vessel, that's the vessel that supplies the liver.
Okay.
When that pressure is higher than normal, that pressure tends to now affect all the vessels behind that portal vessel. I don't know if it's making any sense.
Okay, yeah.
Yes, and then the pressure in all those vessels actually increase. So I remember when we discussed hypertension, we said when just like now you get a balloon, you're blowing air into it and it keeps expanding. When it exceeds its tensile strength, it will rupture. That's the same thing with the vessel. So when this portal hypertension occurs, that's the pressure in the portal vessel. When it gets higher than normal, there's like other vessels behind this portal vessel. This pressure will equally affect them. So it gets to a point where the pressure is now too much, and then the vessels rupture, and then bleeding. The person starts bleeding and vomits the blood out. That could be a cause. Another cause could be there's something we call Mallory-West tear. So this Mallory-West tear happens when somebody is constantly retching or vomiting forcefully, and then the force is so much, the pressure exerted on the vessel there is so much, so the vessels get to rupture. Or the mucosa lining, that's like the lining around that esophageal region, the gastroesophageal region junction, is the mucosa gets ruptured, it gets broken, and then this person starts to vomit blood. Another reason could be, people who have ulcer, peptic ulcer. So in ulcer, we have it goes grade by grade.
Yeah.
No, I don't think grade by grade is the right term. It increases sequentially. What do I mean? The first thing you see in ulcer is erosion. That's when the ulcer, ulcer is an English word, the wound itself is still very small. It's just at the mucosa region. When it extends to the submucosa, it becomes perforation. When it bridges all the lining, these patients will come down with bleeding ulcers. So this person could either vomit blood or pass it out in feces. Another cause of this hematemesis is patients who have clotting factor dysfunction, coagulopathies. Normally, when God created all of us, He puts clotting factors in us. The liver produces clotting factors. The platelets, or people who have maybe inborn errors of metabolism, they have maybe genetic issues, and then they are having coagulopathies. Their clotting ability is not optimal. They get to bleed with little pressure that occurs there. Then some people could be maybe a trauma. Some people could have an accident. Accident is like that's a kind of trauma. So when they have accidents, there could be rupture of vessels, and this person would vomit blood. So these are some things that can cause hematemesis in an adult.
Wow. That's a lot. So, but medical people consider this a very serious condition, like a medical emergency.
Yeah, it is.
Why?
The reason it's a medical emergency, imagine, just create a mental picture of having a cut, and then not just anyhow cut, like the cut is extending to any big vessel, and then imagine blood pumping out. So that's the same thing that can occur there. So someone losing blood in that manner can be at risk of different things, especially shock. The person could be at risk of hemodynamic shock. The person could be at risk of end organ damage. What do I mean by end organ damage? Because the blood is now being lost. It's no longer enough to go around the body and to supply vital organs like the brain, the kidney, the heart. So that person is at risk of end organ damage. That person is at risk of shock. And if not handled immediately and appropriately, it could cause death.
Yeah.
So that's why it is considered a medical emergency. And recall, it's not something that is occurring peripherally. You're not seeing the actual source of this bleeding. So it's actually an emergency because something needs to be done very fast. You need to locate that bleeding vessel and then arrest the bleeding.
You've talked about ulcer. So I want to ask, untreated acid reflux and gastritis, can it lead to?
Yeah, of course it can. Gastritis, just like the name, anytime you hear anything, it means there's an ongoing inflammation there. So untreated gastritis, gastric reflux, when it keeps happening, remember I said, first of all, it starts with erosion. If nothing is done, it's just like the wound is eating deeper. Do you understand? Yes. It continues to affect the other the other layers, and before you know it, you have a bleeding ulcer. So gastritis too is like inflammation. When this inflammation continues to progress, when it starts affecting the vessel, this person can have hematemesis.
Hematemesis. Then there's also some people who have said that drinking of alcohol can actually trigger it.
Yes, it can. How can alcohol trigger it? When remember in one of our sessions where we discussed liver cirrhosis,
Yes.
alcohol is one of the highest, like one of the main causes of liver cirrhosis. So someone who is a chronic alcoholic, that liver is getting damaged. I remember I said when the liver gets damaged up to the extent of cirrhosis, cirrhosis is irreversible. Remember, this person would start having portal hypertension. The pressure continues to extend to the vessels behind, and then it affects especially the esophageal vessel, and then left gastric artery and all those vessels, and before you know it, they've ruptured. This person is vomiting blood. So one of the major things alcohol does is that it majorly affects the liver, causing cirrhosis, and then the cycle continues.
Yeah, the cycle continues.
Yeah.
So let's move to NSAIDs.
Okay.
You always say that when you take abuse or something,
Exactly.
can always lead to something else. So, how can NSAID irritate the stomach and cause it to bleed or cause bleeding?
Okay. When we discussed peptic ulcer, I know we said NSAID is one of the main causes.
Yes.
And what does NSAID do? Normally, NSAIDs, they block the production of prostaglandin. Prostaglandin is supposed to be a protection for the lining of that area. That prostaglandin is supposed to protect it. But now, imagine this patient who has abused NSAIDs to a large extent, and then the body is no longer capable of producing sufficient prostaglandin. That area becomes exposed. And remember, the stomach is acidic in nature. So the acid becomes, let me just use the term toxic, to that unprotected area, that area that prostaglandin is supposed to protect. But now there's no prostaglandin. That area is exposed to acid because the stomach, it's normally acidic. So this acid becomes toxic to that area and then causing the ulceration. And remember I said as the ulceration progresses, it can lead to bleeding ulcers.
So for someone that is already suffering from hematemesis, are there signs? Are there signs you can notice and then you feel like this condition is getting worse?
Okay. First of all, we said hematemesis is a medical emergency. So it's not something that somebody exactly, you won't say it's something that you allow to be chronic because it can't even get to a chronic stage and the person would die. So someone who has had hematemesis in the past or is having hematemesis, maybe let me give a scenario. The relatives just entered the room and then they see the man vomiting blood. You will see that this person is beginning to get weak. First of all, because he has lost a lot of blood. He's beginning to be fatigued, the headache, his pulse will begin to get higher than normal because the heart is trying to pump faster than normal to compensate because he's losing blood. If nothing is done, he'll go into hemodynamic shock. Like I explained, blood pressure begins to drop. If nothing is done, death could come in. So these are something. So it is not like something that can be chronic. It's something you need to address immediately. So these are some things you would see and know that this person has actually lost a lot of blood. Sometimes it gets bad because the intravascular volume is now depleted, is now reduced than normal. So, like I said, the end organs, they will no longer be getting sufficient blood and then they will start undergoing ischemia. They will start dying off. So you don't want it to get to that. That is part of the reasons it's a medical emergency.
So what is it wrong for some people to assume, because I've heard of stories I've not seen where some people, if somebody is vomiting blood, they will tell the person, raise your head up, don't bring your head down. So and with the hope that it will stop on its own. Is there cases or is there a probability where it will stop on its own, or like is it even dangerous waiting for it to stop on its own?
First of all, it's very dangerous waiting for it to stop on its own. The person must be rushed to the hospital, that is one. Then the raising up of the head, you gave the instance of, is it just for vomiting blood or even for nose bleeding or
Both
just
nose bleeding, both
okay
vomiting blood.
for vomiting? Okay, for vomiting blood, raising the head up would not help because you've not addressed, you don't know the vessel that is bleeding. And equally for nose bleeding, raising the head up will not help. I've equally heard people say when someone is nose bleeding, tell the person to raise the head up. No. What you just do for the nose bleeding, you try to apply pressure.
Okay.
Yes, but for the vomiting blood, you can't apply pressure because it's not something that is happening on the exactly.
Yes.
You can't. There's no how you can apply pressure somewhere
Anyway.
to stop to pressurize the vessel that is bleeding. So what you just do in that case is to make sure the person sits upright, not raising the head up.
Okay.
Sitting upright, that way it will help prevent aspiration. Because aspiration can occur if the person is maybe lying down or sitting in a wrong position, and the person, and then the vomiting is projectile coming out with force. That person could aspirate, and then whatever is coming out, the effluent can get into the airway, and before you know it, that one could cause sudden death. So it's just ideal for the person to sit up. People should try to seek help immediately. Take the person to the hospital, not raising your head up.
Can hematemesis happen to children?
Yes, it can. So, like I said, one of the causes in adults is malnutrition. That could still be a cause in children because it's not just adults that could have profuse vomiting or retching. Some babies or children can still vomit with the whole force. So that is a possibility. Then some children can have foreign body impaction. Like now, you hear of babies who swallowed beads, or coin, or just something. It could traumatize the esophagus, that area, and then maybe affect the vessels. Then some children, like I said, they could have some genetic issues where they are having coagulopathies. Their coagulation factors are not working optimally. So any little trauma, they could be bleeding. So it's possible.
So, for someone that probably have been rushed to the hospital because it's a medical emergency, is blood transfusion necessary for every, or it depends on the stage?
It actually depends. It's not every patient that comes with hematemesis that you want to transfuse.
Okay.
There are things to look out for before progressing to transfusion. Some of the things you want to look out for, you want to see if first of all, you have to administer some medications to actually stop the bleeding. So in a situation where you've administered the medication, you want to, like I said, when this bleeding occurs, you see the pulse rate, the body will be trying to adapt some compensatory mechanisms. Like person will have tachycardia, increased pulse rate, increased heart rate, BP going down. For such a person, you will need to transfuse. For some people whose hemoglobin is below 7 to 8 milligram per dl, you would need to transfuse them. But for someone who maybe has just lost a little amount of blood and is still having hemodynamic stability, you don't need to transfuse.
Okay, what about surgery?
Okay, surgical intervention comes in when medical intervention has failed. For example, you've administered all the medications to stop the bleeding and it has failed. Or if this bleeding is maybe from a cancer, or there's a large vessel that was ruptured. In that instance, the medications administered may not do much. So in that instance, you would have to do either a totally invasive surgery or a minimally invasive surgery.
Okay. So after someone must have gone, somebody that it has happened to, are there some follow-up care, like things the person has to note, like you don't have to do this, you don't have to do this, so that this cannot happen again?
Yes, there are. But first of all, we must identify the cause of this bleed.
Okay.
Then, based on the cause of this bleed, the follow-up would follow.
Okay.
How do I put it? The follow-up is depending on the cause of the bleed. For someone now that is a non-peptic ulcer disease patient, the person must maintain his or her medication, must go for her checkup or follow-up visits with the doctor to prevent or to avoid reoccurrence. For someone now who is having liver issues, The person must stop things like alcoholism, because it will further destroy the liver, which has already been destroyed. All those things that will trigger this from occurring, the person must stop it. Then for someone who is normally hypertensive, the person must make sure he's regular or consistent, compliant with his or her medications. Then the follow-up is equally important, because it will help the managing physician or the healthcare provider to know if there's anything like recurrence, to keep up with the management so far ahead, to help keep up, exactly, in order to prevent this same issue from recurring.
All right, lastly, before we go,
Okay.
are there things that one might notice before hematemesis begins? Is there something you notice before, and probably like, how would I put it? Is it like a sign?
Okay, like
or things that, symptoms, yes.
Not in most cases. Most times it just comes suddenly. Most times it's insidious in onset. You just see the patient. That's why it's an emergency. If it's something that will give you like the person will have symptoms before it's happening, some of them may decide to go to the hospital knowing that I've been having this symptom. But most times it's usually sudden. There's no symptom or anything. The person will just stay, and then he's already vomiting bloody effluent profusely. Like I told you, one of the main causes is the portal hypertension from liver cirrhosis. So at this point, it's just like a stroke happening. The same mechanism, where the pressure will be too much and then the vessel will rupture. That's the same mechanism. It's not going to tell you that I'm about to rupture. It won't tell you anything. The patient can just be there, and then the person is now vomiting profusely. That's why it's an emergency and it must be tackled as well.
Wow. Thank you so much, Dr. Favor.
Thank you.
You've heard it on hematemesis. So when people cough blood or sneeze blood or vomit blood, anyhow, as long as there's blood
but
in
then
the output,
coughing the blood is quite different from vomiting
yes,
the blood.
yeah,
Coughing the
vomiting
blood could be from another thing entirely.
But as long as blood is coming out from the mouth
or the nose or anywhere,
you need to go to the doctor.
Exactly.
Because it's blood, and blood, you need blood to survive. So now imagine somebody that is vomiting blood, that vomited blood the first time, second time, maybe they washed bitter leaf and given to the person. And it's not happening.
People can do a lot of things.
People can do a lot of things. I went to the village recently, and my mom was showing me one leaf. Look at the leaf. I said, "Which leaf? Look at the leaf. Which leaf?" He said, "This, they call it 1 million cure." One leaf that has 1 million cure. I said, fantastic. So please, there are some cases where I don't think it's even advisable for you to start treatment on your own. Take the person to the hospital. Let professionals deal with this, because like you heard, sometimes it doesn't stop until they find the source, they find the cause of that bleeding. Even when doctors give you medication and it's not working, they now have surgery comes in. You get, and then you see that small minor thing that you're thinking, let her just raise her head a little. Before you see, you raise it, the person will choke. Choke on their own blood. So, I'm telling you. So please, take them to the hospital. Hematemesis is nothing to joke about. It's a medical emergency.
Yeah.
And if the person is being treated and cared for, ask your doctor, what shouldn't I? Anyway, your doctor will even tell you, but adhere to it. You know, it's not just adhere to it. It's not just hearing it from your doctor. Try, do it and stay safe for yourself and for your family. Thank you so much for hanging out with us on Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. My name is Amazing Rita, and
I'm Dr. Dimba Favor.
Thank you so much. So do well to like, share, comment, subscribe to our channel, and we'll see you the next time. For now, it is bye.